This fall, when Massachusetts and most of the region started to see an increase in infections, the Commonwealth responded accordingly. We deployed teams to assist nursing homes and amped up our testing there. We rolled back the reopening process. We issued a new stay-at-home advisory, and we strengthened our face covering mandate. We restricted what types of procedures hospitals could perform and worked with them to increase their capacity, and we opened up 2 field hospitals. Our administration's also outlined guidance to urge folks for just this year to celebrate the holiday season with those in their immediate household. And if they plan to do anything other than that, to follow the guidance, wear a face covering, maintain distance, don't share food, wash your hands, and remember that in many respects, the people you are safest with, especially during this season of the year, are going to be the people you live with every day. Combined, those steps at the time helped our hospital system add hundreds of beds. And in November, many of these steps were effective in slowing the growth of new infections, but unfortunately that progress was temporary. After Thanksgiving, infections and then hospitalizations skyrocketed, and since then, we've seen that increase slow down slightly, but certainly not enough. Before Thanksgiving, our hospital's acute beds were about 67% occupied. By December 15th, that shot up to around 83% occupied, and we've only recovered 1 percentage point since that peak. Our hospitals are now under significant pressure, and we're heading toward another period, this holiday stretch, when we're likely to see another significant increase in cases and hospitalizations unless everybody plays a very different game than the one we all played at Thanksgiving. As a result, we think it's appropriate to take action now to slow that spread, and we must do so in a way that can avoid overrunning our hospital system. So today we're announcing new statewide restrictions that will be in place for at least 2 weeks, starting Saturday, December 26th. These will be in addition to our existing orders, including the stay-at-home advisory, the face mask requirements, and the early closures that are already in place. Together, the intent of these restrictions will be to pause activity and reduce mobility so we can reduce the spread of the virus without closing our schools or our businesses. The details: effective Saturday, December 26th, capacity limits will be lowered to 25% for most industries, and the Lieutenant Governor will talk more about the details on this shortly. Indoor and outdoor gathering limits will be reduced to 25 people outside and 10 people inside, including for events. This is part of what we must do during this critical period when the vaccine is just a few months away to slow the spread. If we can all agree to do the things that slow the spread over the next 2 weeks, it will help us work on building the bridge we all need to build to the vaccine. Nothing we're announcing today affects anything associated with K-12 education. That guidance is already in place. And as the science and medical data has made very clear, all school districts, even those with high infection rates, can and should bring students back into the classroom. In fact, these measures today will help districts bring students back and bring them back soon. The decision to restrict capacity at so many businesses is an enormously difficult decision. We all know that these decisions carry very negative ramifications on people's livelihoods and their families. The economic package that was passed by Congress will go a long way in addressing some of the financial damage that these restrictions will have for individuals, families, and businesses. But we also know that more help is needed for businesses that are struggling to keep their lights on, and our administration is putting together a significant economic relief fund for the Commonwealth's small businesses that will be most negatively affected by these decisions. And we will present the details on this package tomorrow. Let me just close by saying that we all know that COVID-19 is relentless. Some people become very sick. Others have lost their lives. And for many, it's a mild or a non-event. It's been a hard year for our employers and for thousands of their workers and their families. And it's been a hard year for everyone as we try our best to stay apart and to cancel important milestones and celebrations and change, in many respects, the way we celebrate almost everything we do. Christmas is obviously a few days away. We're in the heart of the holiday season, and it's normally a time for joy, for gathering, and for relaxing and hanging around with those we love. This year obviously is different, but we all need to hang in there, stay vigilant, and recognize and understand that the work we do now has a lot to do with the kind of bridge we build to get to the vaccine. Over 26,000 clinical and non-clinical workers in our healthcare settings have already received their first dose. Moderna received its EUA authorization last week, and the first shipments arrived yesterday, with more being delivered today and tomorrow. We have a robust plan to get vaccines to people as quickly, safely, and equitably as possible. Two-dose vaccinating almost 7 million people will obviously take time. And in these coming weeks and months, we need to bear down on the virus and keep practicing the prevention that so many have delivered on for months here, just a little longer. Wear a face covering, avoid groups, and stay home except you need to go to work or go to school. And do all you can, if you're not going to be with the people you live with, to take proper precautions. This will help us all get through the next push, and it will help suppress the growth of the virus and make sure that our healthcare system can withstand this surge and continue to serve the many people who need it to be there for them who aren't dealing with COVID. And it will also help us keep our schools and our communities open. These messages, we know, are hard to deliver, and believe me, we know they're hard to hear. But we have full confidence that the people of this great state will continue to dig deep and come together in the final stages of this terrible pandemic.